If you've been looking into treatment for pudendal neuralgia, you've probably come across nerve blocks and shockwave therapy as the two main options. What I want to do in this video is give you the honest version of what each one actually does, so you can make a sensible decision rather than a hopeful one. Nerve blocks work by injecting local anesthetic near the pudendal nerve to temporarily interrupt pain signaling. The initial success rate is around 80% for providing some relief. That sounds reasonable. The issue is duration. Research shows only about 25% of patients maintain meaningful relief beyond a month, and evidence from stat pearls indicates that repeated therapeutic blocks tend to lose efficacy after approximately 2 years of ongoing use. That doesn't make nerve blocks useless. They're good for two things specifically. First, diagnosis. A positive response to a nerve block confirms the pudendal nerve as your pain source, which is genuinely useful when the clinical picture is unclear. Second, acute pain management. If your pain is severe enough that you need immediate relief, a block acts faster than a structured shockwave course. Shockwave therapy works differently. Rather than interrupting pain signals, it targets the tissue conditions creating those signals. Low-intensity acoustic waves directed at the pudendal nerve territory and surrounding pelvic floor reduce inflammation, address fascial tension, and support nerve recovery over time. Sessions are non-invasive, take around 15 to 20 minutes, and there's no recovery period. The trade-off is that results are gradual. You're typically looking at 4 to 6 weeks before the picture becomes clear. The honest comparison: nerve blocks are faster acting but temporary for most men. Shockwave therapy is slower but aimed at tissue-level contributors rather than the signal itself. For some men, the right approach is actually sequential: a nerve block to manage acute pain while shockwave therapy addresses what's driving it. That's a more complete strategy than either alone. What makes most sense for you depends on how long you've had symptoms, whether nerve blocks have already been tried, how severe your current pain is, and how significant the pelvic floor tension component is. These are things a proper assessment should work through with you. If you'd like to have that conversation, our free informal chat is the starting point. No commitment, the link is below.